Well, Ascension St. Vincent says a new addition at its Indianapolis campus means the hospital can now handle any emergency patient right through its doors, no matter their age or injury. Business of Health reporter Kylie Valletta is here with more. Kylie.
Thank you, Gary. The hospital recently opened a new burn center at its flagship campus for both adult and pediatric patients. On the same day, St. Vincent also opened a new pediatric trauma center at Peyton Manning Children's Hospital, which is on the same campus at 86th Street. St. Vincent leaders say the two projects help the hospital meet its mission to treat the entire family under one roof. Joining me now to tell us more is Dr. Jeffrey Gibbs, Medical Director of the new St. Vincent Burn Center. Dr. Gibbs, thank you for being on the show today.
It's great to be here.
So you are medical director of the new burn center. We mentioned also St. Vincent opened the pediatric trauma center the same day. Explain how these two projects together are going to expand the spectrum of patients that you can treat at St. Vincent.
Well, it really rounds out the capabilities of the hospital system to treat traumatic injuries. St. Vincent's is already a level 1 adult trauma center, but adding in pediatrics and the adult and pediatric burn center really gives us the capability of handling pretty much anything that comes to our doorstep. The nice part about having the adult pediatric burn center and the trauma programs is it's all encompassing, and it's all encompassing under one roof. For instance, say if you had a family that was involved in a house fire and was brought to the burn center, we'd be able to place the parents and the children next to each other within the burn unit. If they had other traumatic injuries, the pediatric ICU and the trauma ICU are just a short distance down the hall, so everyone is in very close relationship to each other.
And of all the things that St. Vincent could have added at its campus, why did St. Vincent choose a burn center in particular?
Well, one, it does round out the capabilities of the hospital, but two, burn centers across the country usually run at very high capacity. So you're basically adding 8 additional beds to the regional capabilities of Indiana and the Midwest as a whole. So it really does increase our medical capacity to take care of patients.
And typically in the past, I know you had a small burn unit, but you would have to transfer patients, correct?
Correct. St. Vincent's was taking care of some smaller burns, but previously they were transferring them to other burn centers, and now they're able to handle all of these burns right here on the 86th Street campus, along with their pediatric and adult trauma programs.
And one feature of the new burn center, it has some hydrotherapy rooms. Can you explain what those are, the importance of those, and also some of the other features of the burn center?
Sure. So the center was designed to be all-encompassing. The thought process there was that the physicians and the caregiver come to the patients shouldn't have to go to the caregivers. So from the time they are admitted to the burn center, they will remain in the burn unit, whether they are ICU or floor patient. The unit itself is an 8-bed unit. It has 2 hydrotherapy rooms, which is where we do a lot of our wound care daily for cleaning and dressing wounds. There's a in-unit physical therapy area, so patients don't have to leave the unit to do the physical therapy. It is completely bariatric capable, including the hydrotherapy rooms, and we have shower carts in the rooms, which are pretty much the standard of care these days. So everything can be handled right there in the unit, and patients don't have to leave until it's time to go home or they're being transferred out to a rehab.
And you mentioned off camera that the burn center can also focus on long-term reconstruction, and you can think about that in the beginning of treatment for a patient. And a lot of burn centers don't have that capability, correct?
That's correct. So sometimes burn centers have physicians who are general surgeons and sometimes plastic surgeons or a combination of both. There is a handful of us around the country who have done general surgery training and surgical critical care training and plastic surgery training, and are board certified in all 3. And what that does is it gives me the ability to see those patients acutely and think long term. Okay, here's what we have to do today. Here's what we have to do a week from now, a month from now, a year from now, and kind of start putting all the pieces you need to put together to kind of lay out a consistent and cohesive plan from day one through their long-term reconstructive needs in a year or 2. And I think that having surgeons that have both the acute training and the reconstructive training allows us to formulate that plan a little bit better and kind of implement it a little bit more seamlessly across the spectrum of their care.
And just a little bit of time left, but tell us quickly about the outpatient clinic. You also can focus on outpatients at this burn center.
That's right. So the burn center has outpatient is fully capable of handling patients on stretchers, wheelchairs. We have the physical therapy center within the outpatient clinic, so when patients come to have their wounds checked, they can also do physical therapy on site. In addition to that, we have child life that comes over to the clinic, as well as our physical therapists, our social workers, so we can follow up and really meet the needs of these patients from a physical, emotional, social well-being standpoint. So it's all encompassing from start to finish. In addition to that, we also have a dedicated operating room for these patients with some state-of-the-art laser therapy that we use for some of the reconstructive needs.
All right, Dr. Gibbs, well, congratulations on the new center, and thanks for being on the show today to tell us about it.
Thank you very much for having me.